Public Health Informatics, Session 4, Intro to Healthcare Informatics. PowerPoint presentation is presented by Chelsea Kildall. The objectives of this PowerPoint is to determine what public healthcare informatics is, why it is important, how it improves the healthcare industry, who does it help, and is there a career in the field. Public healthcare informatics is defined by Webster's Dictionary as the health of people in general, the art and science dealing with the protection and improvement of community health by organized community effort and including preventative medication and sanitary and social science, the science of caring for the people of the community by giving them basic health care and health information, improving living conditions, etc. So when you look at the definition, it pretty much is self-explanatory. It tells you that it is public health, meaning it analyzes the public's health, and it's an analyzing database system. What is the importance? The importance of public health is key in analyzing the health of the community. Without this system, tracking diseases wouldn't be easy. The system works with the community, not against it. An example of this is, let's say 5 people go to the ER with a GI disorder. It's no big deal, right? Your system, when you plug in all the information, your system's not going to pull up and say, oh, something's wrong, this is what's going on, blah, blah, blah. But if you have 15 people with the same case, it rises an alarm. With a large spike in cases that come through an ER, the database system is going to pinpoint where all the people were from. It's going to analyze what they all have in common, and it's going to be able to determine where the illness is coming from. In my example, it shows 15 cases that triggered the alert. When they looked at the data showed that they all went to the same shopping supermarket and it produced that there was poor food handling practices. Because of that, it indicated an outbreak, which helped the community get it under control to stop more of the sickness passing around. It's kind of the same for like the flu. My next slide is importance continued. The chart to the right is a graph showing January, March, May, July, September, November. 2005 is in the light purple. 2004 is in the more magenta color. It is a foodborne disease outbreak in New York City in 2005. As you can clearly see, in 2005, the foodborne illnesses were much higher in between May, July, and into September. It's also pretty much into November as well. So you can see that there were outbreaks going on. When they plug all this data in, they're able to see where this is coming from, how big it was in the community. When they have this kind of information, it's easy for them to determine whether or not like a certain food chain is handling food improperly. Kind of like, say you go to Texas Roadhouse and everybody in your family gets sick, and the table next to you gets sick, and the table next to them gets sick. So they're going to analyze that information in the system. The system's going to produce, oh, they all ate at Texas Roadhouse. Then the health inspector for food is going to go to Texas Roadhouse, figure out what's going on. 9 times out of 10, it's because people are handling food improperly. They're not washing their hands. They're sneezing on the food. All kinds of stuff like that. People don't have hair nets when they're cooking, which gets hair in your food. So importance continued again. Why public health? The importance of public health lays in the importance of community health. If you don't have a healthy community, you're not going to be healthy yourself, usually. You'll have better vaccines with better health care, improved hygienic and toiletry, meaning like clean running water, a sewer system where it's not just leaking out into the system, kind of like we've all seen on the news for Haiti since Hurricane Matthew went through. And it lessens illnesses. Improving public health management for an action impact. Dr. Wilson Forget, former CDC director and senior fellow at the Bill and Marlene Gates Foundation, said in 60 years, impact will be the same kind of signature program as epidemic intelligence service and will address one of the major barriers in global health today, the gap between tools available and the delivery of those tools. Well, what are those tools? So impact is going to help create, I don't know how to explain it, a management tool for competency needed to run programs and ensure efficient and effective healthcare system operations. So think about when you go to the hospital. If you don't have a certain healthcare bridge that's going to connect your information to your doctor and your nurses, it leads to poor patient care. So without that simple basic right there, you're going to have a very bad time at the ER. So this program is going to improve public health management. It will grow highly trained public health managers in partner countries to work with scientists, advance health agendas, and improve health outcomes. Improving the industry. So, public healthcare informatics cuts costs. It predicts outbreaks, tracking disease, allowing local physicians to inform their patients, ability to track foodborne illnesses in the area. Public health informatics helps the industry by allowing transfer of information to the public and local medical facilities in order to prep for or contain an illness. A lot of us see it on the news for E. coli, and that's just improper handling of food. There's a cholera outbreak right now in Haiti as well, and that's from drinking dirty water. So public healthcare informatics is able to track that data, to track the outbreak, to pinpoint where the outbreak's at. How does it cut costs? So when you go to the hospital and they don't know what's wrong with you, they run all kinds of tests, right? Well, let's say you and Bob and Bob's entire family of 15 ate at the same restaurant, and you come in about the same time as Bob. Anyways, you'll be in with Bob, and they're going to be able to determine that you and Bob ate at the same place. So they're going to be able to narrow down if you guys ingested bad food. Without that kind of infrastructure, they're going to run unnecessary tests on you, which is going to cost you more in the long run. It's going to bump up your insurance premium, and nobody wants that. To the right, I have a diagram picture. It says scope of public healthcare informatics. So it shows you like outbreak management is part of the design, development, implementation, evaluation, and maintenance. It's all part of public healthcare informatics. So that's how it cuts it. Who does public healthcare help? Well, obviously it helps the public because the public is in the name, public health informatics. It informs the public of outbreaks by data collection, improving the community's health by providing necessary vaccines to protect against deadly diseases. My example is children's vaccines. We almost had measles and all that stuff eradicated. And due to lack of mothers getting their child vaccinated, measles is on the rise, whooping cough is back. The next thing I'm afraid of is polio. So hopefully everybody gets their kids vaccinated because this little one, I don't want her getting sick. Is there a career in public healthcare informatics? Yes, there is. The CDC itself has a 2-year on-the-job training program called, I don't know how to say it, PHIFP, Public Health Informatics Fellowship Program. In this 2-year program, you are placed in an assignment in the center and office across the CDC, where you gain exponential training and enhance the agency's informatic workforce. Meaning, so you'll be put into an office where you analyze data, and that data helps the workforce to know what's going on. There's also several colleges that have degrees in public healthcare informatics. Just to name one, CSU has one. And I couldn't find for sure on UNC, but I know that they have a healthcare informatic training. So I'm sure there's a degree in it at UNC. You can get online courses. So all in all, I believe public healthcare informatics is something that we desperately need. Without it, I don't think we would be able to track diseases. We wouldn't be able to stop and help outbreaks. And it's just something that we definitely need. I hope you enjoyed my presentation. Have a good day.